So, hey, Dr. Ghozland. Um,
See?
you know, listen, I had a weekend. I'm just coming back. I'm feeling good from holiday, and now's the season where I am connecting back with friends and we're catching up. And sadly, I still have friends that are my age, uh, um, in our summer season. I'm 50, and they are still struggling to have an orgasm. And I'm trying to express how important this is and what potentially is actually going on. And we really, really, really undermine and undervalue the orgasm, right? So if you were to speak to your patients about orgasms, what are you telling them? And I
Yeah.
have my way of expressing things, and I know how important it is, but from a scientific point of view, love time science, what are you telling them?
I'm telling them this. Look, I think there's a lot of misconceptions on what really happens during an orgasm. It's look, if we're just going to look at male versus female, it's really easy. You look at your male partner, and he ejaculates almost every time he has sex with you, and he's having an orgasm. So we say males have a 95% success rate in orgasms.
Lucky us.
Counterpart, you take a female, and she may say, well, maybe 50% of the time I'm having an orgasm, and the rest of the time I don't think I am. And so most women today will say 50% of women today will say that they've experienced an orgasm. 20% of women say they orgasm just occasionally. And then you've got a very small subgroup who are unable to orgasm. So if we understand why this is happening, we have to really understand the physiology and all the different connections, because as simple as we think orgasm it is probably the most complex interacting system between that we go through. So I'll give you an example. In order to really have a good orgasm, we have to have so many systems working in check together. So you have to have your brain talking to your nervous system, improving blood flow to the sex organs, having your muscles contract, right? You have to have your hormones on par. You have to have your emotions have to be in sync. The context of the situation has to be perfect. And all of these have to communicate in order to really enjoy and experience an orgasm. So I always look at it from a very rudimentary standpoint. If you look at your brain, that's kind of the control center. And then our nervous system is sort of the wiring, right? Like, and then the blood flow is like the fuel. You need the blood flow to get everything moving, right? We talked about a little myth here, which is women, when they're aroused, their clitoris enlarges, right? And we can even see a 300% increase in clitoral enlargement. And you've got a beautiful little statue there.
This is my little baby. This is my little 3D clitoris.
Well, let's hold that up because I want to tell the audience something. Show them the very peak that pops out of the vulva, right? It's that little iceberg, I call it.
So your labia majora minora here.
Right. So she's covering it with her majoras, and her minoras are inside, and she's got a little gland sticking out, and people think that is your clitoris.
That's it.
It's your clitoris, but that is the iceberg of your clitoris.
Yes.
Because look at that beautiful body. Not only does it have what we call the crura, which is these that's right, these things coming down sort of around your labias, right?
I'm going to be your Vanna White right now.
Right. And actually, and further than that, what you're not seeing is a three-dimensional picture of the clitoris gland that's going into the pelvis from behind, right? And so it's a very elaborate, complex system. It houses over 10,000 nerves.
All the nerve endings, yes.
So imagine this: out of any organ in your entire body, Frenchie, the most concentrated amount of nerve endings are in your clitoris. The sole purpose of a clitoris is pleasure. How amazing is that? We are born with a pleasure organ. Did you know? I'll give you a little fun fact just because it's cool and I like to talk about this. I'll give you a mammal that has a clitoris that enjoys pleasure with it, the
Oh,
dolphin.
yes, she does.
Can you imagine that? How cool is
Yes,
that? We're not
yeah,
the only.
yes, she does. Come on, mammals. Come through, mammals.
So when you ask me what I tell my patients is, look, guys, now that you understand it takes your brain, your nervous system, your blood flow, your muscles, your hormones, your emotions, your context of the situation. If any of these symptoms are disrupted, whether it's stress, pain, poor blood flow, nerve changes, maybe you're on a medication that does a shift, maybe your hormones are not optimized, maybe you're under a lot of emotional tension and stress, maybe there's issues with your relationship or you've suffered post trauma. All of these can delay, they can weaken your orgasm, they can even make them completely absent. And so it's not always that there's something wrong with me. Maybe along the way of those pathways, we need to figure out what's broken, what can we improve on so
Mhm.
that we can get you reconnected so you can enjoy those orgasms. And the beautiful thing about orgasms is they're not always just clitoral, they're not always just vaginal. They can actually be cervical, right? They can actually be uterine orgasms.
Mental.
They can actually nipple stimulation orgasms. There's so many ways
So,
we as human beings can evoke those emotions and get all these systems working. That
yes.
what's amazing about this, you don't have to have penetrative intercourse to experience an orgasm. And we know that because women who self-pleasure themselves have a much higher incidence of orgasm during self-pleasure than they do with a partner. And that's
Mm,
because they're taking their time.
we have a better roadmap.
You got you understand where it's at. Yeah.
For those who do, we it's something about that roadmap, and sometimes we like to keep that roadmap a little secret, and so there it is. Sometimes we don't want to tell everybody where the roadmap is, and that's okay too. But uh, I think that in thinking about that, when we think about how much religion has intercepted science and disrupted science. And so these messages that you're sharing have not been conveyed to the general population. And once they begin to evolve into life and are able to make more holistic decisions, now you have a different nerve sensitivity in your 40s and your 50s and your 60s and beyond, because people aren't even thinking about orgasms in the 70s and 80s and 90s like we should, because we should be. But I really appreciate you, talking about how, also all of these factors and how we're changing with age. And as we change with age, how we receive pleasure and stimulation and satisfaction, that's all going to change too.
Absolutely. And what I tell everybody, Frenchie, is look, especially as we age and we know that there's less blood flow, right? Maybe look, as we age, like anything else, there's plaque formation in your vessels, the lumen, the pipe itself, whether it's plaque formations, whether it's blood pressure issues, they start to constrict and you get less blood flow, right? So how do you counteract that? Because really, in order to have an orgasm, you need to have improved blood flow. It needs to those that G zone area, that clitoris, that penis needs to be engorged with blood, right? Not only does it improve sensitivity, but it improves everything else that nerve conduction, everything. Uh, so one of the things that I think we fail to mention is as we age, our partners may need longer, better pre arousal or arousal before penetration. And we know that because women who enjoy 20 minutes of oral play or just arousal have a much higher success rate in enjoying an orgasm than just a quickie in the bed, which are fun too. It depends what you're looking for. But if you really want to get a great orgasm, you need a really fun arousal moment.
I really recommend edging, and that may not be a term that everyone is familiar with, but
No,
edging is
explain it. Explain it. I don't even know.
edging is about bringing someone to the brink of an orgasm and then pulling it back and then bringing them back to the
Isn't that
brink
called? Isn't that called blue
again.
ball?
Well, if she doesn't have blue balls, but it bringing her to like
But
almost
I
in
understand. Yes.
there, massaging the labia, massaging the clitoris, and as you said, the clitoris has the most nerve endings. It is specifically designed for pleasure,
Yes.
specifically, and so that means that we should not be denying ourselves pleasure, right? And so just putting emphasis here and playing with it, but then just pulling back a little bit and then play with it a little more, pull it back again, and find other places to bring sensation. And sometimes we don't remember to ask our partners about their erogenous zones and what gets them off, be it whispering, be it nibbling on the ears, suckling around the neck, suckling on nipples. Like for some people, it's elbows, some people's feet, some people it's behind the knees, some people is a little asphyxiation up here in the throat. Like there are all of these different erogenous zones that we should be exploring. And as we age, we go on autopilot. This worked for the last 10 years. So
Well,
I'm gonna keep going with this, and it's like, no, you have to renew. You have to renew. You
well,
cannot
we
say,
talked about that in our last episode, Frenchie, when we
yeah.
said, relationships need novelty, right?
Mm,
And so do our sex lives. And so just because it worked for 10 years and it's fun every other day, it doesn't mean that the end result is always going to be the same over time. And I think what you brought up is super important, which is communication with your partner, right? Hey, what do you think about this? Do you enjoy this? Allowing yourself the freedom of expression, right? And being comfortable to say, I'm not a big fan of that particular massage technique or whatever it is that you're enjoying. But all of this at the end of the day, from a physiological, boils down to your nervous system, right?
mm-hmm.
Your there's an interesting, your nervous system really relies on two main systems, your parasympathetic and your sympathetic. And your parasympathetic is what's going to allow that blood engorgement. That's where you are talking about the kissing, the touching, the nibbling, whatever it is that really arouses somebody. And then the sympathetic is the actual muscle contraction, the pelvic floor is doing its thing. And then that's when orgasms start to happen, right? So it's always a back and forth. And what you were saying earlier, sort of taking him to the brink, then backing off a little bit, you're continuously like heightening that parasympathetic system so that they get so engorged. When that release comes, it's going to be powerful.
Guess what I'm doing right
Oh, I don't even want to ask,
now.
but sure, tell us.
My Kegels.
Oh, your Kegels, yes.
Can we talk about the necessity of Kegels? I mean, I try to do at least 50 a day. Try to get my Kegels in. That's probably why I have a smile on my face, because I have been exercising. We have been exercising.
So
So
yeah, I'd love to talk about Kegels because I think Kegels sometimes are done inappropriately,
mm,
um, and sometimes they're misunderstood on what they can actually do and what they can't do. So, a Kegel exercise, and probably not the best way to describe it, but what I tell patients, because I think they get it and they understand, it's like as if you are starting to urinate and then somebody says, hold it. And you've got to contract those pelvic floor muscles to hold that urine. And so that's sort of a Kegel exercise. I live in California. Um, Traffic is like part of our life here. And
mm,
so I tell all my patients every time you get to a red light in traffic, That's when you do your Kegels, and you do it. It becomes almost auto-reflexive, right? Every time you get to a stop sign, a red light, you're like contracting, and
Stop. Give me 20.
yeah, exactly. And then by the time you get to your destination, you've done like quite a bit of Kegel exercises. The misunderstanding is the following: yes, Kegel exercises help to strengthen pelvic floor muscles. Do they repair torn pelvic muscles that sometimes happens during childbirth? No.
Mm.
Do they actually change the laxity inside your vagina or the gaping inside your vagina that happens after childbirth? They do not. They help rebuild and strengthen the pelvic floor muscles only. The other question is, there's so many cool devices. You and I have talked about this on and off the air. They have these Bluetooth assisted. We now have AI wearable devices that are causing large volume contractions of your pelvic floor. The risk is you can actually over tighten your pelvic floor, and if you over tighten your pelvic floor muscles, believe it or not, you can actually get into situations where you have pelvic pain or pelvic, we call it dyspareunia, pain with intercourse. So just a little tidbit there. Now, it is true that, I always like to talk about why does orgasm change over time? It changes over time because we talked about blood flow issues.
Mm-hmm.
It changes over time because maybe our hormones are not optimized. And I think this is where I want to tell you, Frenchie, and the audience that when you don't supplement, when a woman doesn't take hormone replacement therapy, specifically estrogen, there's changes that happen in your vagina, right? The vaginal walls thin, you lose a little
Then
bit
lubrication, not as lubricated.
and
Yes.
not as elastic, right? And
Yes.
so we have to. That's why it's important when somebody's having a difficult time orgasm. You have to look at all these different things. What medications are they on? Um, what is their relationship like? Do they feel safe? Do they feel bonded? Um, are there hormone issues happening? Is there cardiovascular disease? Is there diabetes involved? These are two, for example, classic diseases that change blood flow.
Mm.
And so, yes, arousal is super important. Connection is super important, and we're going to get into some cool ways of getting arousal, whether it's through devices, lubrication, techniques. But at the end of the day, so many systems have to fall into check. So it's important if you are affected by this or if you've noticed a significant change, that's a great time to visit somebody who specializes in sexual wellness, maybe your gynecologist if they're comfortable with it, and discuss some of these things so you can remedy them, so you can improve your sexuality and your ability to feel sensitivity, improve sensitivity and orgasms.
I got a question for you.
Yo,
Is it the doctor's responsibility to bring these type of topics up, or is it taboo in the industry, or is it the patient's responsibility?
I mean, great question, difficult to answer. I would tell you that I think it's everybody's responsibility.
I
And what I
appreciate.
mean, what I mean by that is, look, and I always say this in a jokingly but not jokingly fashion. I'm a trained OBGYN, even though right now, over the last 10 years, my focus is on sexual wellness. But you would think your gynecologist would be extremely sensitive to what arousal feels like, to what orgasms feel like, to helping patients attain those goals. The reality is there's so much to learn in residency. Uh, Sexual wellness is almost at the bottom of that list, right? And how sad is that? I can't tell you how many patients, Frenchie, have come to my office because they're seeking hormone replacement therapy because they're having pain during intercourse, or they're not feeling friction during intercourse, or because they can't seem to climax, or they're not feeling their partner inside of them anymore. And they come to me because they've seen 3 or 4 different gynecologists, and every single one of them has said, "Oh, that's just normal. That's part of aging. That's to be expected. Um, that's to be expected after deliveries." So the answer is, look, I think we owe it as professionals. It should be our goal to bring it up. I think if we fail to bring it up, I think patients should definitely take the lead on this and not be scared to bring it up. I think sometimes there's this white coat phenomena that happens, right? You're like rushing.
You know what happened though? What happened is, when we were kids, they showed us these unbelievable videos about sexually transmitted infections and diseases. And it's deterred people away from a conversation, because usually when we are visiting our doctors, it's because of a problem and it's not necessarily so that we can be proactive. And so the medical industry is looked at as, especially around gynecology and urology, is looked at as a consequence. Oh, you didn't have protected sex, so now here's your consequence. Oh, you, how dare you trust somebody to be intimate with? And there's this consequence, as opposed to, hey, let's make sure that you have a great, safe, healthy, fulfilling love life, right? And so when we start going to doctors as a means of fixing something, as opposed to prevention and sexual security and well-being, we're always going to have these types of outcomes. And that's why I always appreciate your approach and your candidness and your openness, because in general, our gynecologists, while meaning well, are not as intentional as this. I've had some great gynecologists. They remind me, like, hey, listen, you can still get pregnant. Be careful, have fun, be careful. And I'm like, oh no, not a oopsie baby, not at this age, right? But it is just so rare, that well, maybe not rare, but we don't hear it often enough, that people are finding the happy doctors, the happy gynecologists, the gynecologists,
Yeah.
you know, that want us to have this great love life, either self love or connected love.
And you bring up great points, Frenchie. I'm going to just disagree with you because I think this. I think most gynecologists are seeing 50 patients a day.
Mm.
They're look. It's sad, and it's a sensitive subject, but it's a business. And so you're taking insurance. You get a certain amount of money per patient to see them for a well woman exam. You've got to pay your staff, your overhead, you've got all these responsibilities, and you're getting, $50 for a checkup. You've got to see 50 patients a day, which means you got to allot 10, 15 minutes maximum.
Mm-hmm.
And patients feel rushed, doctors feel rushed. Um, so you go by priority, right? Are you in pain? Nope, I'm good. Any abnormal discharge? Nope, that seems okay.
Mm-hmm.
And then let's get it right into the physical examination. I'm going to do your breast exam. I'm going to do your pelvic exam. Everything feels great. Let's talk about your medications. Are you on birth control? Yep, feels great. No problems. Next patient.
Mm.
The word sex, the word enjoyment, the word fulfillment, the word pleasure never enter the conversation.
Right.
Never had an opportunity to enter the conversation, right?
Right.
So it's tough. Now, you ask me whose role is it? It's everybody's role, because at the end of the day, if Frenchie, you came to me and I rushed you and you said, "Stop. I want to talk to you about an issue I'm having. I'm having a really, I'm in a great committed relationship. I love my partner. We're having so much fun. I've just never experienced an orgasm.
Mm.
Can you help?"
Mm.
Now, that doctor may not be properly trained to help. And
The
that's,
doctor might be like, I ain't having one
yeah,
either. No, just
right. What is an orgasm? And look, that's probably very true, right?
mm.
They're human beings
Sure.
too, with their own issues and problems at home.
Sure.
But they definitely, is deserving of some sort of investigation, some sort of workup, a discussion, because as we do age, things change. And we talked about that, we say it in medicine, comorbid diseases, which means like you're coming to see me for your well woman exam or maybe hormone replacement therapy. And I fail to talk about the fact that you've got heart disease and
Mm-hmm.
you've got diabetes that's maybe not really well controlled. And so if I'm not able to link those into how it affects your sexuality, I'm doing you a disfavor because we know that it affects it. It affects your blood flow, it affects sensitivity, your nerve endings, all of that stuff.
And even speaking of blood flow and sensitivity, when I think about women over the age of 65 who are sexually active, uh, who have not had discussions with their gynecologists or their doctors around vaginal dryness, which can make them susceptible to a sexually transmitted infection because the inner skins are possibly tearing, and then that makes the vagina vulnerable to challenges. And the gynecologist isn't saying, are you experiencing vaginal dryness? I just want to make sure that you're okay because, these things can occur and I want you to be safe and I want you to feel okay. Or the women who, are not engaging with their husbands um, because they are uncomfortable, because they're experiencing this through hormonally, and there hasn't been a conversation in that relationship either about why this is happening. And she too is also not going to her gynecologist. I don't even know if she's thinking like, oh, this is a gynecological issue, rather than her sometimes thinking like, I'm just not interested, rather than, this is where I am because of age.
You nailed it. I mean, I can't tell you how often do we hear people married for 25 years, the woman goes through menopause, her libido and desire plunges, they become asexual, and the next thing you know, they're divorced.
Mm-hmm.
When in reality, it would have taken one conversation, one vulnerability to say something's wrong. I have zero desire to have sex with my partner anymore. And when I do have sex with my partner, it's uncomfortable. And because it's uncomfortable, I really don't want to have sex with my partner now. Right.
Mm-hmm.
So that's something that happens every single day, all the time. And it doesn't matter if you're rich, poor, white, or black. It is something that affects all of us. And there's treatments for this. We talk about the fact that hormones, whether it's, your ovaries produce estrogen, progesterone, and testosterone. We know estrogen's super important vaginally because you have estrogen receptors in the vaginal canal in your bladder. It helps with collagen, it helps with elasticity, it helps with the thickness of the walls, it helps with lubrication, like you said. It minimizes the tears, the micro tears, I call them, that happen, which then scar and it becomes more painful the next time you have sex. Testosterone is equally as important for that. One, it improves sensitivity inside your vagina, but two, it also improves your desire and your libido. And so, if your desire and libido are non existent, then sex is not on your mind. You're not
Right.
interested in it, right?
Right.
And then it frustrates your husband. And most of the time, what typically happens is we stop communicating about it because I get angry that you don't want to have sex with me. You're
Mm-hmm.
frustrated that I don't understand you.
Mm-hmm.
And then we're not having sex. And guess what happens next? Usually not something that would be accepted in a normal relationship.
and
Uh,
and I get a lot of partners, spouses that inbox me about these very specific scenarios, because they're trying to avoid temptation. You know, someone's love levels is here, and her love levels are down here, and they're not meeting here. And you know, a lot of people say, well, if you love me, you would forego your sex life. If
Yeah.
you love me, right? You would just be faithful despite what I'm going through. And you know, really undermining the fact that sex is a need, not just a desire. And because we've wrapped it up in this concept called marriage, um, people feel like you should just do away with, you know, intimacy that you need for the sake of your partner, when
Well,
really
we say
this
it
is
in our
part of
mouth.
the collaborative conversation.
Yeah. No, listen, I couldn't agree with you more. So I have a question for you, French. How do you counsel those couples? Because it's a difficult conversation to have when somebody has zero desire to be intimate with the other person.
Mhm.
And it's so how do you what are your tools that you give them?
I mean, first, I want to know if they've stayed in the boundaries of their relationship first,
Okay.
because those those are two different pathways, right? One, um, this tells me how close the connection is with your partner, and that you're really concerned, but you have some communication challenges. The other one, if you have already stepped out, you have gone beyond communication challenges, and now you are in the space where you're just trying to fulfill your needs, right? And so those are two very different spaces to be in. And so I approach them very differently. So on this side, on at some point, I'm going to recommend that they receive some type of health counseling, and that these are some of the factors that should be considered. Right? It could be exhaustion. It could be you're not feeling emotionally safe. It could be that you're overwhelmed with household responsibilities. There are numerous, and it could be hormonal. So there are such a myriad of factors. However, if you have already checked out of your relationship, if you have violated the trust in that relationship, I first need to speak to you about how it feels to violate that trust, and what what do you feel like you're getting out of that besides something physical, and is that enough for you? And do you want to be brave enough to let this relationship go if you're not going to be transparent and have better communication and open communication with that partner? So those are just two of the dynamics. But I also, you know, I'm gonna invite my friend over here.
Yeah, that's right. Let's talk about your well, before we get into your friend, which I
Yeah.
want to, know, you brought up some great points, and I'm also going to bring up the fact that we talked about hormone replacement therapy being an adjunct to trying to make you feel more connected, more desire, making it more comfortable to have sex. There's also other things, we talked about the fact that you need to feel, you brought it up, safe, bonded with your
Hmm.
partner in order to feel that arousal getting stronger until you orgasm. And there's some new novel things that we can use in the medical world. Like, for example, there's peptides that are now available. One in particular that comes to mind is oxytocin. We talked about the fact that your brain uses neurotransmitters, one of them being oxytocin, which helps with bonding,
You
which
know where else you get oxytocin from?
nipple stimulation
And humor.
and humor. Yes, you know that you get. I was check this out. I was watching Netflix the other day
Mm.
on this documentary about the amazing, I forgot the title of it, but it has to do with your dogs. And actually, even bonding with your dogs
Yeah.
increases oxytocin.
Yes, it does.
They
Any
want
animal,
more than that.
cats,
Now
purring.
it's bonding
Yeah.
with you, just hugging, just touching, just a little skin to skin interaction releases oxytocin.
Well, you know, people forget that the skin is the largest organ that we have, and the skin requires touch. It requires connectivity. You have to make use of this organ. It is not just to protect the organs, it is also to feel sensation, and that's why our little veins run all through our bodies. Yeah, because people are suffering from skin hunger.
Yeah, and I
They
think
need that touch.
yeah, and I think that's one of the things that I think is probably the easiest thing to start with in a relationships that's deprived of intimacy, in the sense that just start off by maybe you hug naked in bed for a little bit
Yeah,
and cuddle. There's
yeah.
nothing wrong with just getting close, and oftentimes that leads to a lot more fun things. And then also there's medications that improve blood flow. Look, we always joke Viagra, unfortunately, caused a big problem for many women, because their men were popping Viagra's, getting erections when they weren't able to before. Why? Because it dilates the blood vessels, engorges the penis with blood. They get this big hard on that lasts a lot longer than they would normally. And what do men do? They want to have sex with their wives, right? They don't understand. And so they're being forceful. And then we talked about the fact that if a woman is not on hormone, because they're about the same age, let's assume, and she's going through the changes, and her vaginal walls have thinned, her lubrication has changed, and now she's got her husband who's taking a Viagra pill, and it's almost like medieval what happens, right? Because he's causing some micro tears because her vagina is not able to support that kind of action.
Yeah.
So we saw this for a long time, right? Women were coming in saying, "My God, please, like I cannot believe my husband's taking Viagra again. It's killing me," and it really is killing her slowly.
Yeah. Yeah.
There's medications today that work in the same manner for women. There's some new pharmacokinetic medications that are some great stuff. So what I'm trying to say is, you don't have to suffer alone. It's about reaching out, talking to somebody like you, Frenchie, who can give them some therapy, talking to somebody like me who may give them some medical advices and do a workup, and then really finding that sweet spot where two people can connect and really enjoy their presence, because I think if you enjoy each other's presence, everything else will work out for the most part.
I agree. And I think that men deserve the space for slower stimulation, where they are not rushed. Uh, we want to reduce anxiety and pressure in men, because some of them are also running to the Viagra because they feel an increase of social pressure to perform, and so many men are just fixated on the act of orgasm as opposed to experiencing pleasure. Now those are two very different things. It's great when they come together, but if you're with that partner that says, there's like, look at me, did you have an orgasm, did you come, is exhausting, because the orgasm, excuse me, means so much more and different to women, right? And so what's been communicated to men about what's important and what's been communicated to women about what's important, um, those are two very different conversations. And so the man becomes task oriented, and the woman wants him to be, many women, not all, but many women want him to be intimacy oriented, and so,
I think
uh,
very well said.
yeah, and so, the Viagra is supposed to be a resource, is not supposed to be a conquering tool for
And
you.
what we're seeing today, which is what you kind of touched on, which is performance anxiety, right?
Yeah.
And so you've got this performance anxiety, and I, look, we do something called a P shot in the practice. I draw your
Mhm.
blood, I spin it, I take your own platelet-rich plasma, I inject it into the penis. I inject it into the female G spot, into the clitoris, to naturally improve blood flow to the area, improve
Mm.
sensitivity. But when I talk to these young guys in their early 30s, late 20s, coming,
Already, yeah, they are Viagra'd out.
they're Viagra'd out, and why? Because they're watching so much.
Too
Their
much porn.
ideation of what is supposed to be like normal is based on pornography, and they have a misconception of what reality is, and they've gotten dependent upon Viagra to perform because now it's become an emotional, psychological component. And if it's not there, they're not getting an erection.
No, no, and they get. Can you get burnt out on Viagra? Like, can you like stimulate yourself so much that you can't get an erection, or is it always going to control the blood flow?
So I've actually had patients coming in because they're no longer able to get erections secondary to over Viagra use. People ask me, so are you the kind of guy? I'm not talking about me, but you hear talk like, are you able to have multiple orgasms in one setting, right? If you look at it from a female anatomy, it's a lot easier. Females don't have the refractory period with an orgasm that males have. So a woman's very lucky. With the right partner, you can have multiple sequential orgasms where we need a little bit of a refractory. I got to go to the bathroom. I got to, take my blood pressure medication. I need to watch some cartoon. Uh,
Mm,
so
mm.
yeah, we are, even though the clitoris, from an embryonic standpoint, the tissue in the clitoris and the penis are identical,
The
right?
same. They are the same. Yes,
It
they are.
differentiated at some point during development based on hormones, based on genetics. But the point is, the building blocks are the same.
Yeah, yeah, yeah. It's really really interesting.
Frenchie,
Uh,
let's get to your toys.
oh, don't invite me to bring it. This is so this is actually full disclosure. I'm an affiliate with this company, and this is one of their new babies with S5. It's called the Sheic Curve, and there's a male and a female version. I don't like to leave males out, but I do want men to know that there are products and toys that cater to men, just like there are products and toys that cater to women. The packaging alone is just amazing. If I can get into, first of all, I don't know if this baby came from Venus because packaging is just, you know, so beautiful. And I'm excited about this. And I think it's really important to know that, toys are tools and resources. They are not replacements. And I know that there's a huge misconception about toys being replacements of people. They're not. They're not. But whether you're single and partner, I like that, there's a way to hold her and to grip, which is also important around anal play. A lot of people don't know that the anus is a vacuum, right up in there, and so you always need
Where
some.
does it come out?
Oh, it don't. It comes out at the hospital with an emergency nurse. That's where it
Didn't
comes
that
out.
happen to Richard Gere in like the 80s? I'm
I
sorry to bring that up.
remember. And so this is
That was the high school rumor, by the way.
the entrance. I remember that one so well. And so there's a motor here for the vagina, and
Yeah, that's
there's
going
a motor for the
inside the.
vulva. And can we also dispel, like, the vagina and the vulva are two different systems, right? So there's the clitoris, there's the vagina, there's the vulva.
Yeah.
So is
Hey,
is
Frenchie, let
really
me tell you something about something called the G spot. I call it the G zone because I think a spot is really hard.
it's
There's,
yes. And
there's
they're located in different spaces in the woman, like they're not all
they're not
situated
all equal. Yeah.
in the same. So
So you
much
can.
education around pleasure.
I know. I love it. So look, you can have clitoral stimulation. You can have vaginal stimulation. Vaginal stimulation is where there's a little bit of elevated folds of tissue on the top part of your vagina, about 1.5 centimeters in for some women, and it can extend about, up to 4 centimeters inside. And I call that the G zone. And that G zone is something that gets stimulated, that releases that nerve complex, that really can give you those beautiful vaginal orgasms if
Mhm.
properly stimulated.
Get a couple of streams flowing. Get a couple
Yeah,
of,
you can get a couple of streams flowing.
and I like this because the two motors can work simultaneously. I think that that's really important because we do experience orgasms in multiple different ways. Again, here it always starts mentally in the first place, but here in your mind, to the largest organ of your body, the skin, to all the pleasure zones that are through your body, from your neck to the nipples to the navel to the backside to the bump to the thighs, the squeezing of the thighs, all those things. But it's so smooth, it's so soft. Um, I'm looking for. I'll come back with a review. I don't have a review yet, but she is just, and she comes in different colors. So there's purple. I think there's pink. I like the black. Just don't have black sheets because you lose it. But she's so beautiful. She's so
Yeah,
beautiful.
it's complicated.
Yeah, and you can use it with it, and again, it rolls, so it's moving, so that it stimulate, for it to move, and so that you have the sensation with the clitoris, so that there's always that stimulation there, but there's also the penetrative stimulation and the vaginal stimulation. I am just excited, and it's beautiful. It's just art,
It's
right?
hard.
So
Yeah, say
orgasmic
it looks.
art.
So I want to bring this up to the
Full of
audience.
batteries.
I want to ask you a favor, audience. I think we should do an episode, um,
Mm,
a full episode dedicated to best toys and best lubrication, and we
we
can
do need
we
to
could be
do
like
that.
the Oscars of sex toys and
We will do that.
and
Yeah.
we could do like best of 2025 or best of 2026. And I think we should do it because people really, what do you do if you're looking for something? Most people go to Amazon and then they
Mhm.
just look for, oh, it's got 500 4-star reviews. But why don't we give a really more educational outlook on like toys, lubrications, whatever it is, that we'll put out together our pleasure chest,
Yeah.
and I think
And,
that would.
and we're going to include the lubes too, because you
Yeah.
can't just talk about the toys. I think you have to talk about the lubes as well, um, because those are equally important. And again, if we're talking about our adults at level 40 and above, I call them levels instead of ages, but if they're at level 40 and above, life is different for us now. And so let's celebrate it, let's honor it. You have Dr. Ghozland here to give you some guidance on how to approach your gynecologist or your urologist about the questions that you may have. You know what I have to this weird. I I I get Coregasms.
Okay, go explain
So
that.
so Coregasms are orgasms you can get when you're exercising or when you're lifting something. Like I've had trainers and I've worked with trainers, and there are certain exercises I cannot do because I'm sensitive. And I don't need to have that moment while I'm trying to build my
No, but
muscles.
Frenchie, I've never heard of that. Tell me.
Yeah,
I'm not
they
one of
really
the.
certain exercises. I began to Kegel. I began like I It's something
Is it
about,
like a squat or something?
it's not it's certain bending, but it's with a weight,
Okay.
and I can literally orgasm while exercising on particular weight machines. And so there is, and I've learned to tell my trainer, like, you're gonna have to find an
I need a
alternative
moment. Yes,
exercise.
that's so
'Cause
fun. That's awesome.
but
Yeah, I was going to say something, but with that, I really lost my train of thought. Good one.
like, no. I was like, we're not doing that exercise. And at first they're like, well, I was like, I just can't. And they think that I'm just being ambivalent on purpose. And I'm like, oh, I want to get in this conversation with you.
Oh, that's awesome.
Oh, well.
So there you have it, folks.
Orgasmic
You know,
brain.
I want to give Frenchie, I want to give you a shout out. I'm going to sit up a little bit. Frenchie has a company with some really cool gear and clothing.
Oh, you're part of the community.
Yeah. So check this
Because
out, you
we
guys.
do
I'm wearing
want
my
you to
shirt.
come together.
Yeah. So
That's so
really
great.
link for you guys to get some of these T-shirts.
Yes.
We've got some really fun ones, and I love
Because
that.
we have to come together and we have to come together. And we do want you to be a part of our community here at Love Time Science. You're going to be a part of our community. And we're going to build this community get together. It's going to be so great. I'm excited.
Great. So you guys let us know, like, you know, Frenchie and I spent a lot of time talking amongst each other about what topics would we be interested in discussing? What do we think you guys will be interested in listening to? But at the end of the day, if we don't hear from you guys, we'd love to know more about what you want to hear, because we're open, we're building this. We want, like you said, it's a community.
And no topic is taboo.
And
Like
no
we're past the taboos. You actually have a doctor you can be candid with, and I am here to support you social emotionally. So let's
And I
do.
may not know, you know, I may not have the answers, you guys, but and if I don't, I will tell you. I am not going to feed you, you know, erroneous information. And if I don't know it, I'll research it, and I will come back and tell you what I find.
Sounds great. Sounds like a plan. Well, this has been an enlightening day here at Love Time Science. And on Saturdays, we'll see you every Saturday morning to kick off your weekend. I'm Frenchie Davis, the sexual abolitionist, helping you get free.
And I'm Dr. David Ghozland, a sexual wellness expert in cosmetic gynecology. And it's my pleasure to serve you.
My pleasure too. Bye.